CareAsOne is committed to providing a unique virtual collaborative experience for healthcare professionals to come together to exchange information about U.S. healthcare through collaboration, conversation, and knowledge sharing. The Future of Health podcast provides a true infotainment service that helps the industry innovate by sharing expert voices, views, and advice on the important issues of the day. And now here's your host for The Future of Health, Dipty Desai.
Welcome to the Future of Health with CareAsOne. I'm Dr. Dipty Desai, the Director of CareAsOne and the host of this podcast series. For those of you who are new to CareAsOne, it is a large virtual community that brings together various stakeholders in the care cycle, from providers to payers, pharma to clinical researchers, startups, investors, universities, and more. The mission of CareAsOne is to truly care as one by creating a connected healthcare community where the patient is at the center of care. The entire ecosystem comes together to care as one through knowledge sharing with the help of healthcare luminaries and thought leaders to discuss the challenges, gaps, solutions, and transformations essential to make healthcare whole again. The interaction and networking between stakeholders are made possible through the community via summits, webinars, roundtables, leadership circles, and podcasts. In today's podcast episode, I will be talking to San Banerjee, the Chief Digital Officer and VP of Digital Experience at Texas Health Resources. San has more than 20 years of experience in driving product development and digital business transformation. He has worked in IT delivery and management consulting across industries, including healthcare and financial services. Today, he will share his insights on the impact of digital transformation on patient experience. San, thank you very much for setting aside some time and welcome to the show. To begin with, can you please tell us about your role at Texas Health Resources and the journey that has brought you to where you are today?
Sure, Dipty. First of all, thank you for inviting me. Glad to be here and sharing my insights. My journey started in financial services, and I did many things in the regulatory industry and financial services before stepping into healthcare. And obviously, healthcare, there are a lot of things to solve for. I started in the payer side of the business, where I was responsible for consumer solutions, trying to better serve our members in terms of giving digital health and digital health tools to manage their life. That became my passion to understand the whole experience around patients and members. And today I am the Chief Digital Officer for Texas Health, a large provider, working with many payers in the country. And some of the things that I have experienced and what I have built over a period of time is the ability to use digital and technology to really ensure that we are able to really help our community and patients to lead their life better. And that became my mission and goal. And I think I will continue this, for the time that I am in my professional career, and helping patients and members to really lead a better life. And I think there's a lot to be done there. So that's my short kind of a story. And I'm a person who is very excited about and believe that the best is yet to come. And especially in healthcare, and with all of us putting together the effort that we are all putting together, I think we will get there. And I'm very excited to say this, kudos to you and the team to bring a lot of us together in this journey so that we can share insights with each other and learn from each other. So thank you.
Thank you. Thank you. It's people like you who make it very exciting because you're the ones that are the storytellers. We are the ones that are the story capturers. So thank you, Sam, for sharing your journey with us. And healthcare really feels like it's been on the verge of transformation for years, for decades. We went from paper to screens, from manila folders to electronic health records. And that transition took at least a decade to percolate through the country. Then 2 years ago, of course, wham, we get the pandemic. And that caused another disruption. I mean, it broke down these long standing barriers and it accelerated this digital health at a pace that few, like you mentioned earlier, could have imagined, like allowing us to move from this physical world to this virtual world. And moving from physical to virtual has actually changed the patient experience. This is where you are involved. And it'll be great if you can share your insights on this journey of digital transformation and customer experience.
Sure. I think there are three, and as you rightly pointed out, there are three different dimensions why it is kind of forcing a lot of this transformation in the way we are thinking about transformation. Number one, the expectations of consumers have primarily changed, right? And this is being influenced by retail companies, financial services. This is the other part of anybody's life where they are trying to get different experiences and they expect the same from healthcare. Why not? Right? They expect the same from healthcare. So patients and consumers are defining a new service expectation. So that's one of the first lever, which is kind of defining some of this. Second is that with all this new technology around us, with new ways of doing things, it is easier now to embrace some of that to create experiences which we could have never thought of in the past. And obviously, everybody's learning from retailers, everybody's learning from financial services, and healthcare. It has been very slow from adopting all of that, but now there is a pressure on adopting those things to create the convenience and experience any patient and a member really wants. And third is, I will not be doing justice if I don't talk about COVID and pandemic. That COVID has really put a lot of questions in terms of the infrastructure any healthcare enterprise has, and how do we react to changes very fast. So gone are those days where you have 6 months, 1 year projects and initiatives. It has all come down to weeks now. The agility is all driven by pandemic, and that is also creating a new normal in terms of how care delivery is done, service delivery is done. So I will say that this whole advent of moving to virtual, some is intentional because of consumer expectations, and some has got accelerated because of COVID.
That's true. I mean, COVID really brought about, changes in people's business models, etc. Right? And while healthcare had been frozen, like you said, in place till recently, this really just created the fuel to jumpstart and make it happen faster. And you mentioned scheduling appointments, right? And we were talking about this sometime earlier too, that it's really in any other industry that happens in a very different way. Even the airline industry has accelerated buying a ticket and it's become so much simpler, right? But scheduling appointments in healthcare has stayed the same for many, many years. And now people like you are making a difference, are really creating this digital front door for a better customer experience. So, I mean, it would be great if you could talk a little bit more about creating this digital front door and the benefits that both customer and the organizations can see from an adoption such.
So, Deepthi, great question. So, let me go into a little bit of consumer psychology first before trying to get into digital front door. So, if you think about healthcare experience has primarily been a lot of pull. From a consumer perspective, a consumer typically has to go and do the effort to create an appointment to figure out where the person has to really go, compared to a push kind of a mindset in any other industry like retail or financial services, where a lot of stuff is coming to your hand. So digital front door is an attempt to really change the dynamic from a pull to a push. That's the basics of basics, right? Saying how can a health enterprise be more relevant to a consumer by understanding what a consumer needs, so that a consumer doesn't have, or a patient doesn't have to really work hard to figuring out what service can be rendered to the individual and how it can be rendered. Now, it is easier said than done, because as you probably know, any health enterprise has many services to offer, and these services are based on clinical conditions. It makes it very complex. So the idea of digital front door is getting embraced by many health systems, but there are very few health systems that have done it successfully because it is a complex problem to solve. And because when you think about front door, these are some of the basic things that a front door needs to have. It should help better navigation, it should help better care coordination, and also it should help patients improve their life by reducing the cost and becoming more transparent, right? Anything that a patient does or a member does. Now, if you try to put all of these things together, it becomes a complex problem to solve. And I will share my insights. When we started the digital front door journey, we started to figure out what activities and actions have the highest value in a consumer mind. So we started there saying these are the activities where consumers come to us, complex problem, they cannot find us in the right place. Let's first tackle that. And then create a stackable structure so that we can stack things on that whole thing so that we can create a complete experience. I will say that we are not done, and I don't think any enterprise is going to get done on a digital front door, but this is something that is very important for any health enterprise to stay relevant in the game.
So true. And, there's so many points that you brought out there, the pull versus push, putting literally the patient at the center of care is what will enable all of this to happen too. And also, as you mentioned, patients come when they have a problem, but if you could continuously track or monitor the patient's journey, now you can tell the patient, hey, you need to come and see us based on the data you're collecting from them, right? But how much digital is the right amount of digital, right? I mean, the saying goes that everything in excess is poison. So this could be true for a fully loaded digital strategy too. So what, in your opinion, is the right mix, the right balance between the physical and the virtual world when it comes to a patient customer?
So that's another great question, Deepti. Love your line of questioning. I think it is, in my mind, it is still an evolving thing to really answer. And the reason is virtual and digital thing is pretty new from a healthcare perspective. I think many people have created assets. I think the easy part of this is creating assets, digital assets. But the hard part of this is integrating over a journey which is relevant from a patient member perspective. I think the best answer that I can give you is that it depends upon the patient and the condition that the patient has. It is driven by, it is not a one size fit all. Digital may be very heavy for a millennial who doesn't even want to see a doctor once every year. So you can drop a physical kit to the person's house, his or her house, to give samples so that something can be checked from a preventative mechanism. So it is 100% digital, no physical touch point. But somebody who has a condition where somebody has to be followed up, like a person having high A1C, a follow-up can happen in digital, but once a year checkup by a specialist needs to be in physical format so that everything can be checked, the person can have the eyes on the individual. So I think the kind of best practices that I have seen really play well is really acknowledging the fact that it is not a one size fit all. Go by different kind of conditions and the patient segments that anybody has and trying to design the right mix there. I will tell you from a provider perspective, a specialist does not want virtual world because the perception that a specialist has is if somebody has referred somebody to a specialist need to have the eyes on that patient to be operating on top of his or her license. So there are some dynamics in terms of what a provider expects, what the patient expectations are, and what does that condition really need from a mix standpoint. So all those three things have to be put together to define the right mix.
No, and it's so true. Depending, I mean, you said it best, saying one size does not fit all, depending on where in the spectrum or the health spectrum or the sickness spectrum you are. You need to have more and less of the virtual versus physical. But and then, like you said, even depending on where you are as a physician, if you are a general practitioner versus a specialist, it's going to change. and this change needs to happen no matter what, when, and it's not easy for a lot of people to make that change from the physical to virtual, because the experience is different, like you said, the expectations are different, and it differs from one stakeholder to another, depending on whether you're the patient or the physician or the payer or the administrator. Can you tell us a little bit more about, since you probably are at the intersection of all of these personas, how do you manage the experience and the expectations of these different stakeholders? I mean, do they collide sometimes, or are you able to, kind of navigate your way through their requirements?
So I will use the word healthy tension. There is a healthy tension between all the stakeholders in this game. So before I answer your question, I want to lay out three things here. One is, typically digital in many enterprises is an addendum to the physical world, right? Now, I think the world that we have to get into is digital has to be meaningfully embedded into the physical world so that it kind of complements each other, right? We still have some ways to go there. And whenever there's a failure that happens in the digital world, what is the service failure backup from a physical world perspective? That's an area we don't talk about quite a bit, but that is something that is needed as well to be defined as a part of the strategy. So in terms of the tension between the three parties, patients are always looking for convenience, right? Convenience with the right provider at the right time, which basically means that they want convenience from scheduling, they want convenience from the way they consume the service, and sometimes it may conflict with a provider who has a large panel and want to do virtual visits 1 hour in the morning and 1 hour in the evening, because he has a complete panel with the physical access of patients to his office. Now, that's a conflict scenario. It's not that the provider is not willing to do virtual. It is basically that virtual is looked as an addendum to his or her day of life, right? So that's a tension one, which has to be kind of worked through to ensure that they understand that to really give a holistic care, it can be slided anywhere in his or her schedule. So that's number one. Number two is, from an enterprise perspective, if a virtual has to be tied to a scenario where it should be available as an option, any scheduling that a person wants to do. It is not when a person is asking for virtual. If it makes sense that you have to drive 20 miles to get to a provider, can a virtual be an option? So the optioning of the services should not be restricted by the facilities that you have and the providers that you have, and that creates another kind of tension as well, because not every place can support the virtual that is needed. So there comes the question of scale to really kind of address those healthy tension between these three parties.
And then, till now, we even had that tension of, will I get paid if I do this virtual, right? But I think that problem has been solved. So.
Well, it's not completely, because, not completely. Just wanted to add another comment there. There is still a perception out there that virtual engagements are not at par from a reimbursement perspective compared to a physical in-office visits. Now, that is not completely true. With COVID, there was a lot of waivers in place where it was an at-par reimbursement, but longer term, how it shakes out will also define how adoption will happen long term for virtual as well.
But still a wait and watch. Maybe we might regress again once the pandemic goes away from digital to physical. But when you talk about patient engagement and care delivery, there are many, many areas where digital experience matters, right? I mean, there's so many different touch points and so many places that you can make improvements. But, if you really were to pick that one or two areas where digital experience can make the most impact on healthcare, what would that be? I mean, where would you see this? Where do you see this happening, and in a good way today? And where would you like to see it happen in the future?
Sure, great question. So I think the biggest place where digital really can impact today from an experience is, first of all, let's take the dial down to a day-to-day stuff, right? So a check-in experience in a clinic, which is pre-check-in and check-in in the office itself. There's a lot of paper moving in the clinics today, a lot of paper, right? And when somebody gets in, that's an area where, in my mind, if I'm a known patient, that problem can be alleviated and solved through digital in a big way, right? So that's number one. And I think the number two is the ability to create transparency so that any individual can manage their life and wellness better is a huge area from a digital perspective. So that demands a lot of transparency in the way the data is captured, the way data is presented. And I see that digital really can play a big role in that today. Some people have started, enterprises have started, but it is not to an extent of this condition management that is needed, right? So that's a huge area. The third area, which is a huge need for the country, is medication management, which is managing medication and ability to for a patient to manage medication. And I will tell you, Dipti, that the number of patients that forget to take medications is huge in this country, and it creates a lot of spiraling impact.
I mean, all of
um,
us are guilty. It's not that we don't want to take the medication. It's just like it's not top of mind for you, right? And some way to change that would be truly, truly useful.
yeah, and you asked a question about where I see this. So the place where I see this is digital experience for healthcare should be very intuitive and should not be something that somebody has to intentionally go there to really figure out what he or she can get. It should be part and embedded in your life. Like the way you have your Instagram and Facebook, a digital app for your healthcare should be part like something like that. It should be in your first pane in your phone. It is on the third pane today. It has to be on the first pane from a utility perspective. That's where it has to go.
True, true. It should be something that you daily, not only daily, multiple times a day look at. Maybe you can only do Facebook and Instagram if you've already done everything that you need to do for your healthcare app, right? Maybe it becomes a perk. But no, that's it. And during this thing, like as you were talking about digital experience, one of the things you said about scheduling, and to me, what came to mind was contactless care, right? Imagine if you could just go and using an app, schedule everything, and then you go to the doctor. Everything happens without contact. I mean, it was a term that was coined during the pandemic, and before that, it seemed almost impossible for people to see patients virtually. I mean, so from contactless care, I would like to see or hear your thoughts on where do you see the future of contactless care in terms of telehealth, in terms of robotics, any other areas where contactless care could really transform?
Yes, so I think there are a couple of areas of opportunity, and there is a lot of work going on at this point of time. One is using virtual health to really take care of many use cases beyond just a follow up and a physical consultation or a consultation on healthcare with your provider. Because virtual health, from a technology perspective, is growing at this point. There are many things that can be shared with the provider that was not there 2 years back, and that can be done from home itself using a lot of IoT devices, which is internet connected devices at home itself. There's a debate going on in terms of who should be supporting for those devices, but those devices really can be used to have the true information shared with the provider and get the care that is needed. So that's number one. Number two is that in the clinics, there will be automation and robotics as well, right? So think about a robot like Moxie. It's a company which has done extremely well. They are doing in the hospital space. Now, what stops from Moxie to being at anybody's home or in a clinic where that particular robot really can help at least do the check-in, at least do the basic part of your take-in before a provider comes in on a video if a provider is in the back office there. So I see those kind of approaches being used from a contractor perspective and to really take care of low acuity cases into a more faster cycle check-in from a provider standpoint, even if you have to go to a clinic. And I also see that going to the home where there is self-service being used with robotics to take care of basic stuff, right? So, managing your daily vitals, robotics can play a huge role there, right? Like the way you do your weighing machine, is there a machine that can take care of everything vitals that you have to collect if you're a chronic patient and share that with your provider? And there are companies working on this at this point, and I see some adoption there longer term. So I think these are some of the opportunities in terms of contactless care, and also I see virtual getting more deeper, and there will be some continuity of virtual from home to clinic to hospital. So today, virtual is very episodic, right? You talk to a provider, that's about it. The same virtual platform can be in your hospital, can be in your home, right? And it can be connected with your home ecosystem.
And you're right. It looks like the movement is going of providing care from the hospital back to the comfort of your own home, right? I think it was like probably 50, 100 years ago, the doctors used to come to your home to take care of you. And from that, we said, this is not scalable. Let's create hospitals. We created hospitals. We pushed everyone back to the hospital and took care of them. Now we are going back a full circle saying that now that we have the smart digital integration, maybe we can go back to the home and take care of the patient in the comfort of their own home, which totally makes sense. So smart hospitals, smart homes, that's the direction that we are moving towards. Like, can you tell us a little bit more about this trend? And I see it happening more in countries that are not as regulated as US. I had an experience where I was in India and we were able to do this very successfully over there. But over here, I think we're still not there. What will it take to create this hospital at home in the US?
I think it is. I'll come to what it takes, but I think I basically want to mention that there is something that is already started in terms of hospital as home as a concept. I think primarily it is regulation and also the kind of ability for a hospital system to think about that there is care that can be given at home, which does not have to be given in hospital. So there is a disintegration of services that always it has been assumed to be happening in hospital. So there is work to be done on that particular side. But hospital to home is a concept where most of the non-acute patients, when you have going to an emergency and come back to a home, that home setting can be used to be connected to your main hospital, but most of the care can be done in the low cost at home itself. Now that has three legs. One is the leg of regulation of what can be done and what cannot be done at home. Second is the reimbursement leg in terms of payers accepting those kind of treatment to be legit, to be reimbursed the way it is supposed to. And third is the patient experience and the comfort itself. A patient many times may not think that home is the right place for them to get the care and being confident of the care, because in this country there is a concept of somebody checking on me, I need more medication, right? Those are the kind of concepts which probably have to be unpacked a little bit more, saying you still can get the better care at home if you're not acute, if you're not chronic. And even if you're chronic, there is a way to manage that till you are getting into an emergent and urgent scenario, which can be managed in the home ecosystem. So I think the good news is the movement has already started. Medically at home, there's a company which has already started. So the movement has already started. And I think there'll be more and more activities on this space to really create the experience that we are talking about.
I agree, but would it be less expensive to do this at home, or do you think it would be more expensive, or maybe in the beginning the cost would be prohibitive, but do you think the care cost would come down if we were to do this at home?
The whole premise is the cost has to go down, right? So, and it does not have a value proposition in place unless the cost goes down. I think by the time everybody embraces it, there will be an initial setup cost, doing some partnerships with the companies that can help do that. But down the line, from a cost perspective, the cost will have to go down. And these companies that are working in this space, they are working with this assumption. And also it is good for the payers as well, because payers can create a new cost point for people getting treated at home. And they are kind of, I don't think they should push back. They should embrace this with, with all acceptance, saying this is really helpful longer term.
Yeah, yeah. More options for the patient too. I think I have one last question for you. I know we don't have much time, and I was thinking that this could be on the gaps in care. You being in a hospital system, working with everything, the technology is really driving care as you are involved in it deeply. Where do you see the gaps and what would you like to see happen? Maybe there are startups out there that are solving these problems, and maybe this could be a wake up call for them to talk to you. So, are there any gaps that you see, solutions that you would like to see in digital experience?
Yeah, sure. I think a couple of things comes to my mind, right? So if you think about any health system, what is the right technology stack? It is still evolving, right? Everybody kind of grapples their way into saying these are the set of things that are needed for me to accelerate on a digital journey. So I always say this: a Shopify for healthcare is something that is a need in the industry, right? Everybody's trying to do that. Everybody has to do it. So what does a Shopify for healthcare look like? And Shopify for healthcare may have a different version for a payer versus provider versus a pharma company, but a Shopify for healthcare is needed. So that's number one. Number two is everybody talks about the data and data insights, but there are very few companies that are able to take the data insights to really make some choices. So any kind of ready-made data accelerators which can be deployed in large enterprises will be very helpful. And I think we have seen this. This is a need for us. The third thing I will say is the ease of working with EMRs, which is, and EMRs will always be a clinical record for us. But how do we become more interoperable with an EMR so that things from an experience perspective can be connected with an EMR, right? So that's an area which I think a lot of systems are kind of working through. And the last one is the clinical decision support system, which is the clinical DSS, which is an area where many companies operate, but there is not a complete solution which really can take care of all the delivery models, care delivery models. Like you have value-based contracts, you have this contract, that contract. So a clinical DSS system, which really can take care of many of these contracts and still help somebody to deliver with great quality, is a need. And we are not an exception.
So there's still a lot of gaps, a lot of challenges, and a lot of problems that need to be solved. So, but you heard it. The future of care is not just convenient, but it's virtual first and will be designed around the customer's needs. So thank you, San, for taking the time to chat with us today and for sharing your knowledge on the impact of digital transformation on patient experience. It has been an eye-opening experience for me, and I'm sure for many of our listeners too. And to our listeners and audience that we have with us, thank you for listening. Don't forget to check the show notes for links to resources and contact information related to today's show. And stay tuned for more CareAsOne podcasts and discussions on trending healthcare topics that you care about. Send in your suggestions on speakers and topics, and we will try to address them. And if you wish to join our CareAsOne community, you can sign up at community.careasone.org to post your thoughts and network with peers. I'm Dr. Dipty Desai, and I hope you have a great rest of the day.